Pressure is mounting on Kingston Public Hospital KPH to restore its central air conditioning system, with management setting a 2-week deadline to fix the unit serving 2 operating theatres. The Southeast Regional Health Authority, SERHA, says the malfunction continues to hamper surgical services. We have the details in this report.
This is not the first time the hospital's central air conditioning system has failed. In fact, the problem has persisted for months, repeatedly disrupting critical services and hospital operations.
The system is an age system, probably over 50 years old, and we have contractors who are working on it, but it comes up with one problem or another while they are trying to repair it. Because of that system, it has impacted 2 of our OR rooms. The temperature is not at the right temperature in those spaces. So only 2 major OR rooms are working. And at this time, what the team has to do is to reschedule some of our elective cases and focus on the major and critical cases at this time while we operate to repair the unit.
KPH Chief Executive Officer Dwayne Francis says maintaining proper environmental conditions in operating theatres is critical to patient safety, infection control, and adherence to clinical standards. He says major repair work is now underway to restore the air conditioning system and return the affected operating theatres to full capacity as quickly as possible.
Because the parts of the units are not found locally, it's not something you can get off of the shelf. Whenever the issues arise, they have to import stuff. Because right now it needs HEPA filters, and they have to purchase them overseas to bring them into the island, because those create the close to 100% fresh air going into the operating theatres. So that is something that they need, along with the repairs that they're doing on the unit. So that's what we're having as a challenge.
The Southeast Regional Health Authority is urging patients, staff, and stakeholders to remain patient as repair efforts continue. It says transparency and timely communication will remain a priority until the work is completed and normal operations are restored.
At this time, we apologize for the inconvenience that the clients are facing, and we do understand the challenge that they're having, and we are prioritizing to ensure that we get back to normal services in the shortest time frame possible. The impact we know is great because persons are awaiting surgeries, and we would want to ensure that all our clients get the necessary care that they require when they enter our doors and our facilities. The organization is looking to shorten this time period with our contractors, and we are looking to see our best over the next 2 weeks we can get back to a semblance to our normal way of operating.
Antonia Atkinson, TVJ News.